there's, I think, a moment where there's a beautiful duality between being informed, being well versed, asking every question. There is no question that's dumb. There is no moment where you're taking, too much of someone's time. It is not only sort of within your rights, but within your responsibility as a parent to be as informed as humanly possible, right? And I think there's a very special role, right, that the dad plays, because here is a moment where very often, yes, you are doing this after a traumatic birth, right? That you are not necessarily in your right mind, and having a partner there of both sound mind and body is an incredible thing. And, if it's not necessarily that partner, then another member of the family and someone else. And so you need to sort of have that sounding board. I think it's really important. And also on top of that, your instinct. This is your child. Your instinct is strong. The following is not meant to serve as medical advice. It is merely the story of my own journey and learning process. All the Unexpected, episode 10, The NICU Dad. Hello, dear listener. Thank you for joining us again today. Here we are in double digits, as it be, episode 10. Exciting benchmark to have reached, I suppose. Thank you for joining me in this journey so far. It's been quite the ride to relive the experience, to really think about a lot of the stories and details and things that have occurred over the past year and during my daughter's stay in the NICU and the time that was spent. And I felt as if we'd discussed a lot about becoming a mother, a lot about the process of matrescence, a lot about the process of expecting. And I felt that there was a space and a need for what happens to the dad in the NICU, what happens to sort of the other half of this parenting partnership, as it be. And so I wanted to have this discussion today, and I'm joined by my partner and producer of this podcast and father to our daughter, key holder of many titles. And so I'd like to sort of introduce on air for the first time. Maybe he'll say a small hello.
Hello. Thank you for having me today.
Yeah, my pleasure, I suppose. So I will put the disclaimer out that the questions were sort of not rehearsed or prompted. And to be honest, I think this is probably maybe the first time we're discussing some of these things with each other, let alone sort of on air. And so I guess I'll just start with my first question. That's fair. When you first found out that we were expecting, what did you picture for pregnancy and beyond?
There was a lot of things that I expected us to have. I expected us to have, the whole experience with our family nearby. I expected us to have the experience of taking her home right away and her meeting her grandparents. And I expected a celebration for her christening. I expected visitors to the house, right away. I expected just not being so isolated. Expected to be there when she was born. Well, of course, when you picture being a dad and watching your child come into the world, you picture exactly that, watching them come into the world, being there with the ice chips and holding hand and coaching through the breathing and eventually watching your, baby come in, watching the crowning, watching the umbilical cord, being clipped, and them handing you and your, partner the baby and holding him for the first time and watching the first feeding, and pretty much the storybook of what you see in every movie, TV show, or when you hear from most stories.
That's fair. I think that's kind of in the grain of things that we've discussed, right? So that when one is expecting, there's a lot of expected, right?
Absolutely.
And so the idea that, it is somewhat a storybook picture. And so I guess to piggyback off that, so here was this storybook expectation, and for you, what was reality actually like?
Well, you were in the hospital for a few weeks before. I'd visited every day. Obviously, you were in antepartum. Your water had broken, so we were trying to keep the baby inside and growing as much as possible, and going as many weeks as we can, as close to the due date. And one day I was there, and they checked the baby's heartbeat like 4 or 5 times a day, maybe 6 times a day, if I recall correctly. And it was always like a typical process. They put the monitors on, we hear the baby's heartbeat, they put it on for 20 minutes, they monitor it, and then, they take it off and we go on about our day. Another day, and another day the baby stays in, another day closer to the due date. Then one day, the nurses had a hard time getting the baby's heartbeat, and it was kind of stressful because you had to lay a certain way, and we kept on trying to keep you comfortable, and they kept coming in and saying, oh, let's try this, let's try that. And it got to the point where the doctor came in very concerned that they couldn't find the baby's heartbeat as consistently as they'd like. So they took you downstairs, and I went with you, and they proceeded to try to do another examination. And upon, I guess they took you to where you would deliver in case there was an emergency. And upon examination, they had realized your cord had prolapsed. And then a frenzy took place where lots of nurses and doctors came in and out, and they, within minutes, whisked you away into the delivery room. Told me, I immediately was trying to go with you, and they told me I couldn't go. There was issues with the state of the world at the time. There was a lockdown and all sorts of different regulations. And that, combined with the fact that it was an emergency, they would not let me come with you at all to the delivery room. And then, I guess several minutes after that, they had come back out with my daughter, and it was all over. It was a quick cesarean section, and she was out, and they brought her by me. They rolled her by, and I asked them to stop, please, to please slow down and let me see my daughter. I was able to get a quick view of her and take a quick little video just to document the moment as much as I could. Then they took her away from me again, and they took her upstairs and told me I wasn't going to be able to see her until they got it all set up. So I immediately turned my attention to you, which I couldn't see you as well because you were still unconscious, I guess, from the anesthesia. And I had to pretty much just wait for doctors to tell me, nurses to tell me anything that was going on with both you and our daughter.
Yeah. And so it's interesting because what did you ever expect in that moment that you'd be the first to see her?
No, I mean, I guess I never thought about it. I would imagine we'd both be to see her at the same time. And then being that you were in the room, that, maybe you would have seen her. But of course, you were having, the cesarean section. So you were unconscious. So out of her family, I was luckily able to see her within minutes of her birth. And it's kind of jarring that it was nothing but strangers and doctors and nurses that were the first to see her and handle her. You know, she was brought into the world in kind of a urgent way, and then I was waiting urgently as well in a cold hallway just on the other side of the doors. So yeah, I thought we was here together.
Yeah. When I think back on it, there were probably at least 12 people in the room, because there were doctors and specialists and surgeons and anesthesiologists and students, because that's what you get in a teaching hospital. And yeah, there's an unimaginable sterility to the whole thing. And so I suppose, how do you feel that you've sort of reconciled this disparate reality? So the storybook thing that you imagined, and sort of what really actually happened. For sort of those of you who are new listeners, it was 109 days. It was 109 days that she spent in the NICU without any visitors but us, but also without us together. And I think that that's, unusual even for the NICU. And so that you've got a lot of talk of the NICU. Speaking of, you've got a lot of talk of the so that, normally I think people speak of the NICU being terribly isolating and it being a sort of unique experience in its own. But in the face of recent events, it's also meant that in many cases, parents were not allowed together. And so we were not in the same room with her for 108 days, because to be frank, we sort of bent the rules a little bit the day before she went home and switched off at the same time and took the quickest picture of all time.
Why do you keep turning over, sweetie? You can't drink your milk like that. She's attempting to turn around and drink from her belly.
And so that aspect of the experience, the aspect that we weren't together for, the first 108 days of her life, like, I don't know, I can speak to how it felt for me, but I think, what did that mean to you?
It was very isolating. We had done everything together up to that point, even being in the hospital with you during the antepartum process. And then suddenly it was, you expect to share responsibility. And then when you're visiting your daughter alone in the NICU, you have to make all the decisions for yourself. And a lot of times you got to make, in certain urgent situations, you got to make, decisions urgently without the ability to discuss it with the other person. And to give you an idea, we also weren't allowed to use our cell phones. You weren't allowed to. So there was a bunch of rules that were extraneous. Like, first of all, usually I guess parents would be together and they would be able to visit the baby at the same time. That was not the case. On top of that, we weren't allowed to use our cell phones. We weren't allowed to call each other or talk or FaceTime at all, because you couldn't have the cell phones running. That was a rule they had. And I know in a lot of NICUs, you weren't allowed to be there the same day even.
Yeah, I mean, so there's a moment of the bottle's in her mouth.
She wants to make her cameo
on the podcast. I mean, there's a moment of feeling sort of somehow lucky. I mean, I've read stories of people, we were told to switch off in the lobby, right? And so it was the kind of idea of saying, okay, one person went downstairs. You could, in theory, do that all day long, every 15 minutes, if you really sort of wanted to do that, right? And you hear stories of people who weren't even allowed at the same day. You hear stories of people in NICU an hour away from home, by car. And so that you end up sort of feeling almost blessed for what is still a really sort of strenuous circumstance. So how does that perspective sort of color the way you feel about it?
You want to be angry, but you really don't have the time to be angry.
Yeah.
Like you think you kind of go through the motions and think, I just have to get the next thing done. And all I kept saying was, I kept praying, essentially saying, I know things are kind of out of my control up to a certain point. I'm just going to do the best I can in every situation and hope for the best. And it wasn't until you sit back and you talk to other people or to each other, we talk to each other and realize how much we were missing out on.
So that's, I think that's part of the journey in itself, is that you don't really process everything at the time. You don't have time to sit back and think how you're feeling, and you don't have time to sort of, wallow in the sense of grieving the things that were meant to be and once were, right? And I think as a mom, I tended to feel very helpless at times, right? Especially in the early days, when so much was on someone else for responsibility, right? We couldn't change her, couldn't feed her, couldn't decide when and how things were happening. But I was able to exclusively pump, and I was able to at least say, okay, I can give her milk. I could do something, right? Did you also sort of feel this same helplessness?
I felt both empowered and helpless at the same time, because there was a lot of things that I was doing that normally the mother would do, in the very first day of life. You were still recovering from the, surgery. So you weren't even like physically able to come upstairs to see the baby yourself. It was just too much pain and it was too much going on. So I was going in between both her and you, trying to feeling a sense of responsibility for both of you at the same time. Her being so helpless and you, also in a sense being so like helpless, like to the circumstances. I wanted to make sure that as soon as she was born, it was kind of a funny story. I call your mother and I say, I need a cooler and salami. And I really wasn't making sense of what, of what I was really thinking. And she was just thinking, okay, I'll say yes, but I really don't know why you would need those two things particularly. And in my mind, I was thinking, well, I wanted to fulfill her wishes. She wanted to like keep the placenta and potentially, transform the placenta, encapsulate it, so, for the baby's health and all sorts of different, purposes. So I was thinking, okay, we need to keep the placenta. So I need a cooler to take home so we can encapsulate it. And then I was also thinking she hasn't had any salami or any sort of like, cold cuts in several months. And I know that she's going to be hungry and she's going to want to eat some of the things she used to like to eat. So I wanted to like take care of you and take care of her, the baby at the same time. And it was very frantic in that sense, like trying to get my thoughts together and trying to get everything, even now thinking back on it, like I really haven't spoken. It's been all this time and I haven't even spoken about this in detail with anyone, really, because as the world has been, there hasn't been anybody really that we've been able to sit down with and just tell the story to. It's kind of just been still going. And now that I think back, I think about the process of events, series of events, and the way they went. Yeah, like I saw the baby when she was rolled out, then they took her away, and then you came out eventually, and I was trying to take care of you, and at the same time, we wanted to make sure we got the first colostrum. So I needed to get the nurse to get you, some sort of receptacle to and then get you the privacy as well, because when they brought you back out from the surgery, there's like other mothers ready to give birth or just have given birth who are in the room, and there was just curtains separating. So then here you are in this extremely intimate moment, this extremely private moment, and you have to deal with other people. And then there was the nurses themselves who were not quite understanding why I had such an urgency to get your, some sort of container for the colostrum, or why I wanted the placenta, and I didn't really have time to explain to them. I just knew I needed to get it done. So there was a battle of trying to get them to help me help you, and then also trying to speak to the doctor as well to see what was going on with, the baby as well, and see what her status was. Was she healthy? Was she breathing okay? Was there any sort of other decisions I had to make? And then there was other health decisions that, things that happen when a baby's first born according to regulations for New York State. And I wanted to make sure that everything that happened to her was run by us before it happened. And that was another stress, trying to make sure that I knew everything that was happening to my daughter and everything that was going into her body and the reason why. And then I had done my research, and I wanted to make sure that I made the right decisions along the way, being that you were incapacitated at first and then you were in pain and distracted after that. So it was a series of decisions that got made kind of in a blur. And I never really had the chance to feel sorry for myself. I never had the chance to be angry. I just wanted to make sure that the now two people, most important people in my life, were healthy and taken care of, and that in the frenzy and, the number of doctors and nurses going in and out of the situation, that nothing fell by the wayside, that everything was taken care of, that I could be attentive to all details at the same time, when in reality that probably wasn't possible.
Yeah, it's a different perspective, because I say, I think, to say that one of us was more sort of in our right mind than the other, right? Mm-hmm. And I recall that moment. I remember coming out of anesthesia, and that's all I could think of. I said, I need to pump and get this colostrum and someone to put it in the baby's mouth, because in my vision of how it had happened, in my vision of what was supposed to happen, she was meant to be born, and while that cord was still clamped and all of the good things were flowing back and forth between her and I, she was meant to be brought to nurse and, watched videos of the babies instinctually crawl up the mother's chest and latch on and get, what they call the most golden of the golden milk. And so, in my mind, there was just this idea of saying, how do we get this done? And I remember the nurse saying to me, oh, well, you can wait and you can wait. And I'm, saying, well, no, I cannot. No. And I remember both of us sort of just looking at each other, and as sort of out of it as I was, and I most certainly was, I said, no, this is still of the utmost importance. And so I think, that's a common theme for a lot of what goes on, is how do you express something that is so humanly important to you in an environment that is so medically sterile, right? Mm-hmm. And so trying to sort of navigate that. And it's interesting that you sort of mentioned this need for advocacy, because that actually sort of leads into the next thing I wanted to talk about. And that was, how important was it for you to be an advocate for our daughter, for you to have the details how did you sort of go about doing that, and what advice would you give, to a dad in the thick of this, to someone who's, facing this head on, and how do they arm themselves to sort of be that vigilant party, right?
And if I had to give advice to any fathers that say, do your research, know your stuff, and be confident, because science is science. There's medicine is in some ways an art, but it's mostly science. If then, you know what to expect if you know, like what's happening, and knowledge is what keeps you calm. It's the unexpected that really can shake you up and cause emotions that are not helpful. You really want to know what's going on. You want to ask questions on every step of the way. You want to ask the nurse questions of why this, why that. You want to read, the ingredients of every single thing that is given to your child. You want to, do research and see what other people have been through. That's kind of the purpose of this podcast. So, for the parents that are going through what we went through, they don't have the same learning curve that we had. They won't have the same stresses. We want you to have knowledge, have power in that knowledge, and have peace with that knowledge, because that's really what got us through. And that's really what got our daughter home on time. With so much that happens in this kind of situation, and so much that happened to us that I was out of our control, you just kind of, the first thing you want to do is get control of something. As you mentioned, as you asked earlier, there's a lot of things that were expected. And when things keep on going to the unexpected, all you want to do is put things back on track and grab control of something. And at least I can get the first colostrum to the baby. At least I can, preserve the placenta. At least I can, for encapsulation, at least I can make the right decisions with whatever medicines were going into our daughter. At least I can get you comfortable and fed. There was things that I thought I can still do. And, I thank God that at least I was able to call somebody, your mother being the person, to at least give me some sort of assistance or guidance, because at the same time, we were moved into a hospital room upstairs that we were, we had 3 weeks worth of stuff there, and food and clothes and personal effects like all over the place. And we had to get to a new room for the postpartum, which was on a different floor, and they kind of like abruptly kicked you out. So on top of having your baby born at 26 weeks, being 1.5 pounds and being so young that her eyes are still sealed shut, being in an incubator with doctors and nurses you had never met before, because all the doctors that you were dealing with up in the, antepartum were different now than when you were meeting for the first time, that had just taken care of such a momentous thing in your life and somebody so important to you, and you had no idea who these people were. So navigating that, and then here your partner had traumatic surgery and was in extreme pain, and you wanted to take care of that. And at the same time, you wanted to make sure that, the hospital wasn't going to just take your personal effects and all your stuff and just throw them out or some, hospital staff person was going to come and pack stuff up for you and potentially lose things or mistreat things that were really, personal to you. Or there was just so many things that we had to, so it was taking care of the baby, taking care of the mother, taking care of the wishes of both of us, taking care of our personal items and our personal effects, and moving us from one hospital room to the other, and then relaying information to your mother and your parents all at the same time. It was kind of a struggle for all those things to occur at the same time. And I guess to get to your question, the advice I would give would be, don't panic. Number one, don't worry, because despite all the craziness, you seem to be, I was, at least in my case, was more clear-headed than I'd ever been before in my life. Although I wasn't able to communicate it as well verbally as some, like my salami and cooler text messages, I still knew everything that I had to do instinctively. It was like a sixth sense kicks in. So don't panic. Don't worry. You know, the Lord kind of leads the way.
Yeah. I think that there's a lot to be said for that. And it's interesting because so I've also heard, my mom's side of the story throughout this, and them really sort of playing this game where they were trying to stall for as long as possible. And so, basically the new room wasn't ready and they were being kicked out of the old room, right? And the people kept saying, okay, why are you guys still here? And, I'm saying, well, what were we supposed to do with all this stuff? And, I remember saying to her after, imagine if you hadn't been able to be here or someone else wasn't here. I said, the weight of things on couples, and she says, here we were just kind of hiding really quietly in the room. And, she goes, 3 hours later, the nurse walks in and, your dad's eating your hospital tray dinner and I'm watching TV and this is the scene that, sort of unfolds. And so it's a question of really just saying, like, how much of that support is there, right?
Well, that we also kind of like forced hospital to allow them to help. Like we sent your parents upstairs to help pack up for you, for us. And if that wasn't the case, which is the case for pretty much every single set of parents that gave birth during the pandemic afterwards, there was nobody allowed in the hospital, nobody allowed near there. So, a father would have to, both the parents would have to deal with all of that on their own, like even packing up the room, so like here you are trying to make a decision. Should I go be with my daughter? Should I be with my partner? Or should I go pack up the room to make sure our stuff isn't all messed up and that partner is comfortable and has all her things, and that my daughter is not receiving anything that I don't want her to receive, or, that she's, if there's any sort of emergency, that there's not like decisions being made without me. Cause like, how would I know if there was some, let's say her lungs collapsed or her heart stopped or some sort of emergency? I wouldn't find out about what happened until after they made the decision for that. So I wanted to be there at the same time as I was with you. At the same time, I wanted to be with the stuff.
Yeah. Yeah. And I think that idea of sort of being pulled in many directions, right? It's that moment. But I think, one of the things that I've sort of, stressed in my mind and said needs to be addressed is this position of remaining in that mindset of advocacy, right? That you can never ask too many questions, that it should never be a sort of default, just do what you will with, my partner or the baby. And that there's that kind of need for that sort of continued resilience of advocacy.
Yeah. I mean, it's funny because like, it's really true that I haven't actually spoken about any of this out loud. I guess I thought I had it way more together than I appeared, because here was the nursing staff recommending, hey, why don't you speak to the chaplain and they can probably help you like relax a little bit. And I remember speaking to the chaplain, meeting another person for the first time. And that was the only person that was allowed near us. Not your parents, not my parents, like nobody else, but this stranger. And here I am crying. I recall tearing up and crying while I was trying to express myself to him, and kind of thinking to myself, like, I'm sharing this moment with a stranger. Like I should be hugging my family right now, or hugging my partner, or holding my baby. And instead I'm speaking to a strange man I've never met before and crying, which is something I don't do very often, if at all. And it was, I guess now that I think about it, it's kind of surreal that I got used to the isolation right away, because you kind of snap out of it and continue to execute. You know, you just have that moment. You have that moment. You have that moment. I wouldn't call it a moment of weakness, but that moment of vulnerability. And that vulnerability doesn't go away. Didn't go away for me for the remainder of the year, essentially. You know, like even visiting her in the NICU and like having to, you know, we lived across the river, you know, in New York City. She was born in Manhattan. We were in Brooklyn, and fortunately enough, we were close enough to the ferry. We can take the ferry, but like once again, we couldn't go together, so everything was alone. You know, like even going to visit her was a process that you would do alone, and you'd have all these thoughts, and you had nobody to talk to about it, and then you're pretty much vulnerable and alone throughout the entire process. Even though you come home and talk about things or step out to the lounge and make a phone call to each other, like still you're sitting there alone for 8 hours, you know, like a day with your child, and you're taking, you know, your public transportation back and forth to the hospital alone. And for some parents, they're driving an hour and a half to the hospital. You know, we were fortunate enough to be close enough, you know, but still alone. And it all started when, right from being separated, like from the second they separated us, and right before you went into to get your cesarean section, we were alone essentially, even though we were together, and all the way up until pretty much this moment.
Yeah, which is, you know, you hear the baby in the background because this is the extent of our childcare, you and I, and that's a reality, and I think that's become a very universal reality in this awfully titled new normal, right? And it's interesting because I think that sense of isolation, for at least me, colored the nature of all of her firsts, right? Mm-hmm. And so I kind of want you to speak a little bit on that. And so as she made progress, what did this sense of isolation and how did it sort of color things like the first time you held her and the first time we would go to feed her, which would both be after nearly 60 and nearly 100 days. And so, you know, how was that so very different than you could have ever possibly imagined it? You know?
Well, I guess, yeah, I mean, you could even go with the decision of like speaking to the chaplain, and one of the first thoughts I had was, you know, what if she doesn't make it? I want to make sure she's baptized before anything, God forbid, happened. So like everything from her baptism, her, you know, it wasn't a christening celebration like, you know, like I'm a Hispanic households growing up with all our other children. We usually have a big party, you know, and all the family around for the first, you know, godparents are there and everything. And here I am in a frenzy calling, you know, my sister and my cousin and asking them, you know, to be the godparents, and then getting in contact with the priest and organizing a time with the priest to come do the baptism. And then when the baptism happened on the second day of her life, you know, she was 2 days old. It was just the priest, who I had never met, once again, another stranger, myself, and an incubator. And I'm nervous about the priest touching her because, like, here is her fragile, translucent skin. You could see her veins and her organs through her skin. And I'm like, it's like a stranger's touching her with these gloves. And like, we knew with the pandemic and everything, I didn't know what germs this person was carrying. And, you know, like there was just so many things that you simultaneously had to think about and worry about. And then
even making that decision of which one of us would be there for that. And so it turned out that she was christened on the day that I was released from the hospital. And so here it was, you know, still very much unwell, in a sort of 10 a.m. discharge for the hospital. And we had spoken to the priest and he wasn't going to be back till 3 p.m. And I said to myself, where am I going to wait and sit? And can I even do that? And the answer was no. And so it became a question of not even really and from my perspective, having a choice to sort of be there or not, and just saying, okay, well, I guess I'll watch the video.
Yeah. And there I was trying to record record the event while participating in the event all at the same time, when I should have just been there enjoying it, and even with her first feeding, like, I had to collect your colostrum and then a Q-tip and stick the Q-tip in a little vial and then put it on, our daughter's lips and watch her little tongue come out and mop it all up. Like I did that alone once again. Like the first time she tasted her mother's milk was just me and her. First time she tasted her mother's milk was just me and her and not her mother, Like these are all things that, like, once again, that never said out loud, never thought about until now.
Yeah, I don't think I'd thought about it in that perspective. But the first the first time that she had breast milk, I wasn't even there. Wow. Yeah, I don't think I'd thought about it that way. But holding her for the first time, because I spoke about that recently, and when we talked about the 59 days, and that it was that long, and so we had to decide also, right?
Who was going to be there first?
Who was going to be there the day she got extubated, and we were finally allowed to hold her, so that it meant that I waited 59 days and you waited 60, right? And you came the next day and you held her. And
yeah. I mean, even the process of, like, the extubation, like extubating, meaning taking taking her off the ventilator and taking the tube out of her throat so she can actually be removed from the incubator. Because you have to imagine there's a baby who's laying there and has an IV in her arm, and that IV gets changed, like every other day, essentially. And they had to find new veins, and then she had a tube down her throat to help her breathe. And, that had to be adjusted as she grew, because if it was too deep, it wouldn't be, corrected. And then she's also receiving, medication for, a staph infection that she received while at the hospital. So her, as like all sorts of different complications would delay the extubation. And we would come prepared one day to hold her, and they were like, oh no, it's not, there was a lot of waiting as well. Like, oh, she's not ready to be extubated yet. Like, oh no, not today. And then finally, when she was, fortunately you were there to have a first with her, because I had so many firsts with her, and you were the first to hold her. And then here she's wearing this face mask. I'm seeing pictures later. The nurse had to take pictures of you holding your daughter, like you can't hold her and take selfies at the same time. And then you also want to do skin to skin. So like you want to make sure she gets as much, like personal, private time, but you're not private because you're in this giant room with a bunch of strangers, essentially, like walking by, other parents, nurses, other doctors, people, staff,
maintenance,
staff cleaning up, around the NICU. Yeah. All sorts of strangers and strange things. And here you are trying to take your shirt off and hold your baby for the first time and have a private moment. And you also have to wear this mask, and you have the mask over your face, and the baby has a mask, and it's kind of like Bane from Batman, like it's two masked individuals trying to get close, but you're banging your mask together as you're trying to get close. And then at the same time, you're talking about holding a baby that's maybe like 2.5 or 3 pounds. It's completely fragile and tiny, and you don't want to break them. Like you don't know exactly how to hold a baby that small. You never had held a baby that small before. So holding her, like all these things that you did alone, all these experiences were exacerbated by more difficulties that were normally wouldn't occur. Normally you wouldn't have to worry about or deal with. You'd have your partner there to hand the baby to you, to go back and forth. You wouldn't be wearing a mask. The baby wouldn't be wearing a breathing mask, as she was wearing. At the same time, there's still also, all these monitors and an IV and all this stuff that's still in the baby as well. So she's hooked up to all these machines, and you don't want to unplug anything or pull anything or turn the wrong way because you might hurt her. And these are all, things, and this is something, holding your baby, that should have happened within minutes of seconds of the baby being born. together, and here you were, as you said, 59 days it was, 60 days for me. 2 months later, finally, after all the anticipation, getting to actually hold your child. And then you have to worry about the tubes and the IV and the breathing mask and your own mask and
taking down your mask to give her a kiss, feeling like a federal offense.
Yeah, like nurses looking at you, making sure, don't drop your mask. And you're like, I just want to kiss my baby on the forehead. Like, that's all I want to do. I just want to be able to kiss my child and hold my child without any, body or anything hindering that. Can I have one thing? Like all these things that we didn't get to have. We didn't get to be in a room together when she was born. We didn't get to hold her. We didn't get to feed her. None of her family was able to be there to even support us, let alone see her. We weren't in the same room together yet still. We weren't allowed to talk on the phone or FaceTime with each other while we were with her. Can I at least have a private moment, without any hindrances to hold my daughter for the first time? Nope. Tubes, wires, nurses, maintenance people, all sorts of things that normally wouldn't be. And there you were again, once again, 2 months later.
Yeah, I remember just even that day, right? So here, we'd waited so long for her to be extubated, and then she was extubated, and they said, oh, the vitals are not looking good, so we're gonna, administer something and wait another 2 hours. And I don't think 2 hours has ever felt longer in my life. And so then those 2 hours are up, and then somebody said, okay, well, actually, no, we should actually just wait till the next care time. And because you just missed that one, that's going to be another 2.5 hours from now. And I almost lost my mind, and I almost broke down in tears. And in tears, one of the nurses looked at me and she said, we'll make this happen. But even just the idea of needing permission to do so much that involved your child, how do you navigate that?
Yeah, I think that's probably one of the hardest things is you need to ask permission to do things that you normally wouldn't need to. It's like you mentioned the care time, to understand, the baby's in the incubator, and you kind of don't want to stick your hands in there and mess with the baby in between care times as much. And care time is when they'd come and they'd change the baby's diaper, adjust the tubing, change the IV. The baby would have to get a CBCs, which is like the blood count. At that time, it was 6 times a day. So here you are watching a nurse with a little needle prick your child, your tiny little 1.5 pound, 2 pound, 3 pound child, and she cries and cries, and she doesn't know why you're doing this to her, but it has to be done. And that would have happened 6 times a day while you were there, and you had to wait until that time again before you can hold her, because you didn't want to take her outside. And obviously the incubator had a certain temperature and humidity level, and the baby couldn't be exposed to the dry, cold air of the hospital just willy-nilly. You had to plan that all. So if you missed your window, you weren't able to hold her. And that's what you're describing there, is that the nurse was like, oh, wait till next care time, well, that's another 2 hours I have to sit here thinking about how I haven't done this yet, and how I have to wait for some stranger's permission to do it.
Yeah. Yeah. And I think that's one of the hardest moments, to sort of navigate this sterility of an environment, to navigate so many things that just really, frankly, as much as you understand it's best for the baby in certain parts, and there's reasons behind certain things, it just at moments does feel inhumane, right? And there's that kind of aspect of navigating that without getting angry, you're saying, because you don't have time to do that, right?
Yeah, you don't want to get, that's another thing that's hanging over your head. If you have any sort of emotion, then perhaps they would take privileges away from you because you're disturbing the process of the baby's healing, or whatever the case may be. You're kind of at the you have to withhold your emotions because you're dealing with strangers that don't, I mean, as much as they may understand because they do that for a living, they don't understand because they're not the parents. They don't know you personally, so they don't know whether you're having an emotional episode or whether you're just being normally emotional.
Yeah, very true. And so I think it's a good segue into the idea of, so when this was finally over, right? When you finally sort of saw that light at the end of the tunnel and you said, okay, now we can actually take her home. The day we went home, like, I know that I had sort of my own whirlwind of things because there were so many things that led up into it, including like having to nurse her with a timer, right? So that she was able to get the number of mLs and reached her daily goal. And we spent, days getting her on full oral feedings and all the sort of check boxes. And then we finally said, okay, like we can stop holding our breath and we can take her home today. Like what went through your mind in that moment?
Well, that was a process as well, because there's something called bradying. When a baby has a brady, that's when its heartbeat and breathing levels drop low, to a point where you might have to resuscitate the child, like, oh, let's take it. Hold on, I got you. You just intermission for baby puke. That's what just happened. One sec. Just to give you an idea, what's happening right now is the baby, since we're still all alone and we still are not around family, we have to watch the baby while record this podcast, and the baby needs a diaper change. And we had to clean up a little spit up as well, because the baby's bottle was just finished as well. So the process is, the baby's on a ventilator, and then the baby has to move up to each level of like getting closer to breathing room air, as they call. So like it goes from the ventilator to, they change the settings on the ventilator where the baby does more and more on their own because you want the lungs to develop, and then they put a mask on the baby, and then from the mask you go to like the nose prongs, and then from the nose prongs they're breathing room air, and then once they're breathing room air, they need to be able to breathe on their own with no incidents. And an incident is what you call like a brady, what they call bradying.
Bradycardia.
Bradycardia, yeah. So that's when the baby's heartbeat or breathing drops below where, they should be. And it's really scary. The machines all beep. And there's a little bit of chaos. And if the baby doesn't recover on their own, then they have to, go in there and do some sort of intervention, like shaking the baby, or in worst case scenario, resuscitation. There's a lot of things that can cause that. It could be, the baby also has a feeding tube in. So if you put too much to the feeding tube, it can cause stress on the baby. They can't pass gas, can't burp, and then it causes the heart and the breathing to drop below, where it's supposed to be, and they have another brady. And we were told you can't bring the baby home until they go 5 days without an incident, without a brady. So that's essentially 5 days without your baby's heart stopping or without your baby stopping breathing. And you can watch, the nurses aren't able to sit there and watch the baby the full time. You can, if you're the parent, you can kind of see it coming and like see when they're in stress, and then get them in a position so that they don't have an incident. They can burp or whatever the case may be. You avoid that happening. But when you're not there at night, there's nothing you can do about it. You can't, it's essentially, we try to be there 24 hours a day, but there would be, 6 to 8 hours overnight that, the baby would just be alone with the nurses. So we'd call every night to make sure that the nurse was staying on top of it, because in your mind, it's like, if the baby has an incident while you're not there, then you reset the clock. It's another 5 days. You can't take your child home. Yeah. So here we were stressing every time we left. We're like, oh, great, another day without an incident, without a brady. But then you come back in the morning and you find out, oh, there was an incident at 3 a.m. or 4 a.m. Restart the clock. 5 more days, 5 more days, 5 more days. So it was a constant struggle of trying to make sure that you communicated with the nurse to try to make sure that they would pay close attention to the things that you noticed were causing them, to, try to give, your child a chance to prove that they're healthy enough, In our case, it was usually overfeeding.
Yeah,
she was being, she'd get more than she could handle in a particular feeding because it was a tube feeding, or eventually when you move to the bottle feeding, they weren't burping, properly or whatever the case may be, and they'd have an incident. So, when we finally got the nurse that would understand exactly how our daughter was, how she functioned, I guess, what made her burp easily and what, and what signs she'd have to like struggle so that you can help her along. We finally were able to take her home. And it wasn't until we had the same nurse for several nights in a row who was able to pay close attention to her the way we would, essentially.
Yeah, I mean, it came to a point where you just felt awful for going home.
Yeah.
Where, and at that point, the roles had sort of reversed, right? Because in the first sort of week of her life, I was recovering. I wasn't really able to be there. And you were the one that was there with her. And then in that sort of last week, because we had started nursing on demand,
you were there all the time.
It became, sort of just, there was no other person to do it, right?
I couldn't feed her.
Literally, right? So it became a moment of, 12, 14, I think the record was like maybe 15 hours one day, right? Yeah. And I just recall that feeling of just saying, I'm an awful parent, that I have to go home, that I have to rest, and just kind of trying to navigate that in itself, Yeah,
it's really something to leave your child in someone else's care right after they were born, especially like, once again, strangers. And you get to know the nurses, of course. That's a nice thing. But we were in a NICU where there was a lot of babies there. It was one of the largest ones in the country, I think.
Yeah.
So there was a lot of different nurses, and there was, you just kind of ask, like, oh, who's on today? And you get to know them over time. If you're there, as long as most babies are there for days, maybe a week, most babies aren't there for multiple months. So we had a rapport with the nurses, and we were there long enough to see the doctors rotate in and out, do full, like, 2 months gone and come back to the same doctors again. Because you even had different doctors, A lot of parents, they wouldn't participate in every single step of the the decision-making process. We did, we insisted on being involved in what they call rounds, where the doctors and the nurses would discuss, all the things that were happening with each patient, and they'd make decisions on what to do next. And there was, a lot of times when you have a new doctor coming in, they make decisions based off of like charts or their previous experience. But of course, each patient's different, and parents, who are there every day know the tendencies of the child and knows what the child needs. So we insisted on being involved with every decision, including how much she gets fed, how fast we move her up to the next amount of milliliters, all sorts of different things about her treatments and stuff. And we did that twice a day, where we participated in rounds, and in the morning and the night rounds with the different doctors. So we got to know all the doctors as well. Yeah. And it was that vigilance, I think, that got her to come home as soon as she did, because I believe that if we weren't so diligent, we weren't so vigilant with our care and with our, observations and our research, then perhaps she would have still had incidents. She would have still had Brady's. She would have been, increased on food too fast, or there was a lot of different factors that would have been outside of our control, which really were outside of our control, but we tried to grab as much control as we could, which kind of goes back to what we were originally talking about. From that first day, you lose control and you just try to get it back, and it's instinctive.
Yeah, I think there's so much to be said for not only arming oneself with knowledge, because I think that's sort of the best turn of phrase to use, right? It is in itself a powerful tool and almost a weapon, right? The literal more that you know, right? And so there's I think a moment where there's a beautiful duality between being informed, being well versed, asking every question. There is no question that's dumb. There is no moment where you're taking, too much of someone's time. It is not only sort of within your rights, but within your responsibility as a parent to be as informed as humanly possible, right? And I think there's a very special role, right, that the dad plays, because here is a moment where very often, yes, you are doing this after a traumatic birth, right? That you are not necessarily in your right mind, and having a partner there of both sound mind and body is an incredible thing. And if it's not necessarily that partner, then another member of the family and someone else. And so you need to sort of have that sounding board. I think it's really important. And also on top of that, your instinct. This is your child. Your instinct is strong. I recall a moment where I had gotten to know the link between my daughter's heart rate and her temperature. And there was a day where I kept seeing it, and I said, she's cold. I promise you she's cold. Can we please check this? And, the nurse says, oh, and I said, just, I know we are supposed to wait till the next care, another 3 hours, but just do me a favor and look at it now. And, lo and behold, she takes the temperature and it's lower than it should be. And she was thrown into the warmer, and she looked at me and she says, I've done this a long time, and I've yet to see a parent who's that on it. And I said, that's my job. That's what I can do. And I think that's really a very important aspect of all of this. And so that's kind of, interestingly enough, the next thing that I was thinking to sort of say. And so as you reflect on a lot of this for the first time, and as you are really thinking back in detail, what, if anything, do you wish that you had known before all of this?
How much power a parent really has, and how much control you actually do have over your child's care. When your baby's in a vulnerable state, and there's, doctors and nurses that have experience taking care of children with the circumstances that your child is in, you kind of feel like you don't have control, and you have to relinquish control to someone else. But that's not entirely true. I wish I would have taken control a lot sooner. I believe that maybe she would have done even better than she did. I wish I would have done the research a lot sooner before she was born, instead of after she was born and while watching her in the incubator. Once again, the best thing you can do is educate yourself. With knowledge comes calm and comfort and peace. You don't want to relinquish that peace. It's okay to be emotional, but you don't want your emotions to control your decisions. You want to avoid the unexpected.
Yeah. And I think to sort of, to be able to navigate what is in many ways a minefield, right? To be able to sort of say, okay, I can take each day as it comes and take each step as it comes, because it's so important to be able to sort of take a step back, and infinitely difficult to actually say to do. And so, I think that's really the kind of crux of a lot of what I've been talking about in last week's article, and kind of leading up into this, is the idea that you as the parent need to empower yourself. And so as here we are, a week away from her being a year old. Like time has flown. What are you looking forward to most in the future as she grows? How do you see this journey continue?
In many ways, our story is a success story. And I just want to see success for everyone else who goes through the similar things. I don't want to see children suffer unnecessarily. I don't want to see parents suffer unnecessarily. I want success stories. And even when you can't control the things that are happening, if things go sideways or go awry to the point where the worst case scenarios happen, you should still have peace in knowing that you did everything you could, because at the end of the day, that's all there is. You can do things with the knowledge that is available and with grace and providence and with confidence and compassion. And if you do all that, even if things don't go the way you wanted to, at least you know that you did everything you could. I know sometimes people are alone too. They don't even have a partner. There was a lot of situations like that in NICU as well, where I'd see just one parent taking care of a child, sometimes two. It's a lot. It's a lot for someone to go through. And if you see someone else going through that, if you see someone else going through something alone, sometimes you don't know what to give as advice. Maybe just be there to listen and ask them and have them express themselves, because even to this point, I haven't expressed myself or said any of these things out loud. We haven't even, we've been together every day with our daughter since she came home back in July, and we haven't even discussed these things because we're still kind of just going forward, all alone, no extra help. So it helps to talk to them, talk to that person going through it, and let them talk out their own feelings and their own thoughts, because sometimes if things are going so fast, you need a second to reflect, to see what's happened so you can make the right decisions now. And what you do now will shape the future positively.
Yeah, I can't agree more. I think there's an instinct often to try and comfort people, right? You hear these stories of things that are said to NICU parents, like, well, at least, you can sleep through the night, or, well, they'll be fine. They'll be home soon. Or, I once knew somebody who had a preemie and, he's 25 now. And I think there's a moment where everyone really does have, the impetus to be helpful. Because I don't think anyone wants to be unhelpful. But I think the crux of what both of us are kind of saying is that oftentimes what is most helpful is to listen, right? To be that sympathetic ear, to listen, and to really just say to that person, whether it's someone going through it or that person you see alone sitting at the next incubator, right? Just being able to say, how are you doing? Do you need anything? Tell me what I can do. Because that sort of simple turn of phrase is infinitely more powerful than sort of any anecdote or any sort of piece of unsolicited advice that you can offer. And so, yeah, I think there's sort of a lot that we've talked about here that we've sort of never articulated before. And I'm kind of at the end of my planned questions, but if there were anything else you'd want to add.
Yeah. Don't forget to take care of yourself as a parent, because you can't help anyone unless, you can't be a foundation to build on unless you are rock yourself. It's not selfish. I mean, obviously you feel like every moment you're not with your child, every moment your child in somebody else's care, every moment you're not there, you feel like I'm doing something wrong or like I'm not doing enough. But you need your sleep. You need to eat. You need to be comforted when you're upset by someone you love. You need to be able to be of right mind so you can take care of that little one. You hear her in the background.
Yeah. And so, yeah, on that note, I think it's important to remember that it is a marathon, not a sprint, right? And that it doesn't end the day that your child gets released either, right? And you'll talk to NICU parents, there's follow-up appointments and there's, check-ins and there's milestones and there's growth and there's, even as everything is fine or it's not, you still at times do hold your breath because this has been a process, and that taking time to heal, taking time to process, taking time to reflect is important, and it's vital to you as a parent to be able to be healed and to be able to be the sort of best version of yourself for this child. And so I'd like to thank all of you for joining us today. It's been a pleasure to kind of have this conversation. I look forward to any sort of questions or comments or concerns. If any of you out there are sort of in the midst of this and feel like you've got a specific question or concern that, we didn't address or that you'd like to bring to our attention, please do get in touch. We really would sort of relish the opportunity to impart some of our wisdom and experience with someone else. So we can be reached via our website at alltheunexpected.com. That's one word, all the unexpected. Via Instagram and Facebook at the same, All the Unexpected. And also now on Twitter at All Unexpected. So please feel free to reach out, and wishing all of you a happy and healthy and blessed week. Thank you.